Today's video is on hypertension, high blood pressure. High blood pressure, also known as hypertension, can lead to serious problems like heart attacks or strokes. However, lifestyle changes and blood pressure medicines can help you stay healthy. So high blood pressure is a common condition that affects the body's arteries. This is also known as hypertension. If you have high blood pressure, the force of the blood pushing against the artery walls is way too high. The heart has to work harder to pump blood. Blood pressure is measured in millimeters of mercury, mmHg is units, and in general, hypertension is a blood pressure reading of 130/80 millimeters of mercury. As I said before, the units mmHg or higher. Blood pressure higher than 180/120 millimeters per Hg is considered a hypertensive emergency or crisis. So any of these blood pressure numbers should seek emergency medical help. So untreated high blood pressure increases the risk of heart attack, stroke, and other serious problems. It's important to have your blood pressure checked at least every 2 years, starting from the age of 18. There are individuals who require more frequent checks. Healthy lifestyle habits such as not smoking, exercising, and eating well can help and prevent and treat high blood pressure. There are individuals and patients who need medicine to treat high blood pressure. So let's have a look at different types of blood pressure here. So you have normal blood pressure, which is a blood pressure lower than 120/80 mmHg. You have elevated blood pressure, where the top number ranges from 120 to 129 millimeters Hg and the bottom number is below, not above 80 mmHg. If you have stage 1 hypertension, the top number ranges from 130 to 139 mmHg, or the bottom number is between 80 and 89 mmHg. For stage 2 hypertension, the top number is 140 mmHg or higher, or the bottom number is 90 mmHg or higher. If your blood pressure is too high, it puts extra strain on your blood vessels, heart, and other organs, such as your brain, kidneys, and eyes. If it's not treated, it can increase your risk of serious conditions, such as heart disease, heart attacks, strokes, heart failure, kidney disease, and vascular dementia. Symptoms include headaches, blood, vision, and chest pain. So, blood pressure is determined by two things: the amount of blood the heart pumps and how hard it is for the blood to move through the arteries. The more blood the heart pumps and the narrower the arteries, the higher the blood pressure. There are two main types of high blood pressure. Firstly, they will look at primary hypertension, which is also known as essential hypertension. Secondary hypertension are also many risk factors. So primary hypertension is also known as essential hypertension. For most adults, there's no identifiable cause of high blood pressure. This type of high blood pressure is called primary hypertension or essential hypertension. This tends to develop gradually over many years. Plaque buildup in the arteries, called atherosclerosis, increases the risk of high blood pressure. You have secondary hypertension. This type of high blood pressure is caused by an underlying condition. It tends to appear suddenly and cause higher blood pressure than does primary hypertension. Conditions and medicines that can lead to this include adrenal gland tumours, blood vessels problems present at birth, also known as congenital heart defects, cough and cold medicines, some pain relievers, birth control pills, and other prescription drugs. There is also illegal drugs such as cocaine and amphetamines, kidney disease, obstructive sleep apnea, and thyroid problems. Also, if you get a health checkup, this can also cause blood pressure increase. This is what's known as white coat hypertension. So I mentioned about the risk factors. These include age. So the risk of high blood pressure increases with age. So up until age 64, high blood pressure is more common in men. Women are more likely to develop high blood pressure after age 65. Your ethnicity. So high blood pressure is most common among black people. It develops at an earlier age in black people than it does in white people. You're more likely to develop a high blood pressure if you have a parent or sibling with the condition. Another cause is obesity or being overweight. So excess weight causes changes in the blood vessels, the kidneys, and other parts of the body. These changes often increase blood pressure. So being overweight or having obesity can raise the risk of heart disease and risk factors such as high cholesterol. A lack of exercise can also cause weight gain, and increased weight raises the risk of high blood pressure. People who are inactive also tend to have higher heart rates. You also have tobacco use or vaping. Smoking, chewing tobacco or vaping immediately raises blood pressure for a short while. Tobacco smoking injures blood vessel walls and speeds up the process of hardening of the arteries. Also, you can have low potassium levels. So potassium helps balance the amount of salt in the body. A proper balance of potassium is important for good health. Low potassium levels can also be due to a lack of potassium in the diet or conditions such as dehydration. If you drink too much alcohol, so alcohol has also been linked with increased blood pressure, particularly in men. And stress levels can lead to a temporary increase in blood pressure. And that saying about stress as well, if you eat more, use tobacco, or drink alcohol, this can also lead to an increase in blood pressure. And finally, you can have certain chronic kidney conditions. So kidney disease, diabetes, and sleep apnea are some of the conditions that can lead to high blood pressure. These are the complications that can arise from hypertension. So you have heart attack or stroke, aneurysms, heart failure, kidney problems, eye problems, metabolic syndrome, changes in memory, understanding, dementia. So let's look firstly at heart attack or stroke. So the excessive pressure on the artery walls caused by high blood pressure can damage blood vessels and body organs. The higher the blood pressure and the longer it goes uncontrolled, the greater the damage. Uncontrolled high blood pressure can lead to hardening and thickening of the arteries due to high blood pressure, or other factors can lead to heart attack, stroke, or other complications. An increased blood pressure can cause a blood vessel to weaken and bulge, making an aneurysm. If an aneurysm ruptures, this is life-threatening. When you have high blood pressure, the heart has to work harder to pump the blood. The strain causes the walls of the heart's pumping chamber to thicken, and this condition is known as left ventricular hypertrophy. What happens is the heart can't pump enough blood to meet the body's needs, which results in heart failure. High blood pressure can cause the blood vessels in the kidneys to become narrow or weak. This leads to kidney damage. Eye problems. You also have increased blood pressure, which can cause thickened, narrow, or torn blood vessels in the eyes. This results in vision loss. You have metabolic syndromes. This syndrome is a group of disorders of the body's metabolism. It involves the irregular breakdown of sugar, known as glucose. The syndrome includes increased waist size, high triglycerides, decreased high-density lipoprotein, high blood pressure, and high blood sugar levels. These conditions make you more likely to develop diabetes, heart disease, and stroke. For your changes of memory understanding, so uncontrolled high blood pressure can affect the ability to think, remember, and learn. With dementia, you have narrowed or blocked arteries which can limit blood flow to the brain. This can cause a certain type of dementia called vascular dementia. A stroke that interrupts blood flow to the brain can also cause vascular dementia. So, to diagnose blood pressure, you'll get questions asked about your medical history and symptoms. So, a stethoscope is used to listen to the heart. The blood pressure is checked using a cuff usually placed on your arms. So, the cuff has to fit. And if it's too big or too small, the blood pressure readings can vary. The cuff is inflated using a small hand pump or machine. Blood pressure is measured in millimeters of mercury. A blood pressure reading has two numbers. You have the top number, which is called the systolic pressure. The first or the upper number measures the pressure in the heart when the heart beats. Then you have the bottom number called diastolic pressure, and this measures the pressure in the arteries between heartbeats. So high blood pressure hypertension is diagnosed if the blood pressure reading is equal or greater than 130 stroke 80 millimeters of mercury. A diagnosis of high blood pressure is usually based on the average of two or more readings taken on separate occasions. So this is grouped according to how high it is. So this is called staging. So staging can help your treatment. So you have stage 1 hypertension. So the top number above 130, between 130 and 139, and the bottom between 80 to 89. You have stage 2, which is 140 or higher, and the bottom is 90 or higher. So sometimes in that case, the bottom blood pressure is normal, but the top number is high. So this is known as isolated systolic hypertension. This is a common type of high blood pressure in people older than 65. So for diagnosis, you can also have ambulatory monitoring. So a longer blood pressure monitoring case can be done to check the blood pressure at regular times over 6 or 24 hours. This is called ambulatory blood pressure monitoring. You have lab tests where blood and urine tests are done to check for conditions that cause or worsen high blood pressure. So you have blood tests to check your cholesterol and blood sugar levels. You can also have tests to check your kidney, liver, and thyroid function. You can have an electrocardiogram done. So this is quick, painless test which measures the heart's electrical activity. So it can tell you how fast or how slow the heart is beating. So during an electrocardiogram, sensors called electrodes are attached to the chest and sometimes to the arms or legs. Wires connect the sensors to a machine which prints or displays results. You also have an echocardiogram. So this is a non-invasive exam which uses sound waves to create detailed images of the beating heart. It shows how blood moves through the heart and heart valves. So treatment for blood pressure, so there's quite a lot in this slide, so I'm going to go through quite a lot of it. So you can have lifestyle changes firstly, which is eating a healthy heart diet with less salt, getting regular physical activity, maintaining a healthy weight or losing weight, and limiting alcohol and not smoking. Right? So I'm going to be on the medications here, right? So this depends on how overall your health is and how high your blood pressure is. So 2 or more blood pressure drugs can often work better than one. It can take some time to find a medicine or combination which works best for you. So when taking blood pressure medicine, it's important to know your goal for the blood pressure level. You should aim for a blood pressure treatment goal of less than 130/80 millimeters Hmg if you're a healthy adult age 65 or older, a healthy adult younger than age 65 with a 10% or higher risk of developing cardiovascular disease in the next 10 years. You have chronic kidney disease, diabetes, or coronary artery disease. So firstly, looking at water pills, diuretics. So these are examples including chlorpheniramine and hydrochlorothiazide. So these drugs help remove sodium and water from the body. These are first line use to treat high blood pressure. So there's different classes of these, which include thiazides, loop, and potassium sparing. So what one you will get depends on what sort of other conditions you have, such as kidney disease or heart failure. So a side effect of diuretics is increased urination. So you can end up urinating quite a lot, which reduces potassium levels. You need a good balance of potassium to help the heart beat correctly. If you have low potassium, also known as hyperkalemia, you could end up taking a potassium-sparing diuretic, which contains triamterene. Then you have angiotensin converting enzyme inhibitors. So these drugs help relax blood vessels. They block the formation of a natural chemical which narrows blood vessels. These include stuff like lisinopril, venazepam, captopril, and others. You also have angiotensin 2 receptor blockers. So these drugs relax blood vessels. They block the action, not the formation of an actual chemical that narrows blood vessels. Angiotensin 2 receptor blockers include candesartan, losartan, and others. You have calcium channel blockers. So these help relax the muscles of the blood vessels. Some slow your heart rate. They include amlodipine, diltiazem, and others. So calcium channel blockers can work better for older people and minorities than do angiotensin converting enzyme inhibitors alone. So it's important not to drink or eat grapefruit products when taking calcium channel blockers, because grapefruit increases the blood levels of certain calcium channel blockers, which can be dangerous. So other medicines include alpha blockers. So these medicines reduce nerve signals to blood vessels. They help lower the effect of natural chemicals that narrow blood vessels. So these include doxazosin, prazosin, and others. You have alpha beta blockers, which block nerve signals to the blood vessels and slow the heartbeat. These reduce the amount of blood that must be pumped through the vessels, and these include carvedilol and labetalol. You have beta blockers, so these reduce the workload on the heart and widen the blood vessels. So this helps the heart beat slower and with less force. Beta blockers include atenolol, metoprolol, and others. Beta blockers aren't usually recommended as the only medicine prescribed. They usually work best when combined with other blood pressure drugs. You have aldosterone antagonists. So these can be used to treat resistant hypertension. So they block the effect of a natural chemical that can lead to salt and fluid buildup in the body. Examples include spironolactone and eplerenone. You also have renin inhibitors, such as allosterone, which slows the production of renin, an enzyme produced by kidneys that starts a chain of chemical steps that increase blood pressure. So because of a risk of serious complications, including stroke, you shouldn't really take allosterone with AC inhibitors or angiotensin 2 receptor blockers. You also have vasodilators, which stop the muscles in the artery walls from tightening. This prevents the arteries from narrowing. These include hydralazine and minoxidil. You have central acting agents, so these prevent the brain from telling the nervous system to increase the heart rate and narrow the blood vessels. These include clonidine, guanfacine, and methyl dopa. So these are always taken as prescribed, and you shouldn't really skip a dose or stop taking them. So if you stop taking these ones, this can cause a sharp increase in the blood pressure called rebound hypertension. If you skip doses because of cost, side effects, or forgetfulness, you need to speak to your doctors about that. So there is something called resistant hypertension. So you can have resistant hypertension if you take at least 3 different blood pressure drugs, including a diuretic, but your blood pressure remains stubbornly high. You're taking 4 different medications to control high blood pressure. And if you have this, it doesn't mean your blood pressure will never get lower. It just means that you need a more effective treatment plan. So this can include changing blood pressure medicines to find the best combination and dosage, reviewing all your medicines, including those bought without prescription, and checking your blood pressure at home to see if medical appointments cause high blood pressure. This is known as white coat hypertension. I mentioned earlier with the lifestyle changes such as eating healthy, managing weight, and making other recommended lifestyle changes. So that's the end of today's video. So quite a long one, that one, but I hope you've enjoyed it and you've learned something new. So thanks very much for tuning in again. Thank you, bye bye.